afternoon. Good afternoon, everyone. We have a lot to cover today following National Cabinet, but before we begin, yesterday I visited the towns of Morawa and Minginoo, which are among the large number of communities impacted by Cyclone Seroja back in April. This was amongst the most devastating natural disasters Western Australia has seen for decades. The impact across the disaster area has been considerable. I had the opportunity to meet with emergency services workers, business owners, local government representatives and local residents. The resilience of these communities is remarkable and commendable, despite the challenges they face. I'd like to thank everyone involved in the ongoing clean-up and recovery effort. It is a mammoth task. State government agencies are continuing to undertake work on the ground day in, day out, as they have since the disaster hit. We're also working with the federal government to finalise the next stage of recovery funding. This will be a multi-million-dollar package to help with the long task of recovery and rebuilding these communities. It will be a significant package covering a whole range of recovery and rebuilding initiatives, and we're working hard with the federal government to finalise the next stage of support. One issue I must raise as a matter of urgency is the role of insurance companies in responding to this disaster. Insurance is the most significant issue facing people in these communities. Many businesses, farmers and residents are facing long delays in having their insurance claims processed and actioned. In many cases, people have been waiting months for assessments and follow-up on their insurance policies. I urge insurance companies with clients in these areas to expedite the work required to pay out their claims as a matter of absolute urgency. These people have been through a lot. The cyclone was a traumatic event. I ask that the insurance companies have consideration for their circumstances when processing their claims and do so as quickly and expeditiously as possible. I contacted the Insurance Council of Australia today to seek urgent action to ensure everything possible is being done to make sure the insurance companies are acting on these people's claims. I can report WA recorded 0 new cases of COVID-19 overnight. That means there are still currently 14 active cases in total in Western Australia, 4 in hotel quarantine and 10 on board the BBC California ship in Fremantle Harbour. WA Health is still monitoring the BBC California ship, which remains berthed in Fremantle. I am assured every step is being taken with the ship and crew to ensure there is minimal risk to the people of Western Australia. It's clear each day this week the situation around the country has become even more dire. While WA was able to quickly crush our Delta outbreak, other states have had a longer battle. Around the country, there are higher daily case numbers, fresh outbreaks and more infectious cases that have been out in the community. It shows the importance of WA's control border in reducing the risk to our health and our economy. As an example, land arrivals to WA are down roughly 75% since last week, but we're not hiding behind our control border. We're actively helping other states deal with their outbreaks because the sooner they're brought under control, the better off everyone will be. We're providing contact tracing support to New South Wales and Victoria. We're currently in discussions with South Australia working out what they require. And I can confirm today that we've received an additional request for assistance from New South Wales for extra contact tracing support. These are very concerning times, but Western Australia stands ready to help as needed. It's in the national interest. That is why Western Australia is here to help. The virus must be crushed and killed as soon as possible. We want the New South Wales government to succeed. We need the New South Wales government to succeed in crushing the virus. Our experience is if you lock down properly and use every weapon in your arsenal, then you can kill it. That's what New South Wales needs to do. What this reinforces is that vaccination is so important. It's our best way out of the pandemic. I'm happy to inform everyone of the encouraging news that WA has reached a vaccination milestone. WA delivered its millionth dose of COVID-19 vaccine around lunchtime today. This is fantastic news, especially given the milestone was achieved a couple of days ahead of schedule. But it's so important that we keep it up. Since our announcement yesterday of an additional 10,000 bookings a week from the end of July, as well as new clinics in the city and the country, there has been an encouraging uptake of appointments. Around metropolitan Perth, I can tell you there are still appointments available in the next few weeks. If you go online or call now, there are appointments you can book at Claremont, Joondalup and the new Convention Centre clinic in the CBD that opens in August. Every eligible Western Australian should go to rollupforwa.com.au and make a booking as soon as possible. It's simple, it's easy, it can save your life, and to those who aren't eligible yet, and to those who aren't yet eligible, you should go to the website and register your details. My advice to everyone is get vaccinated as soon as you possibly can. Thank you very much. Are there any questions?
New South Wales ask for our share of Pfizer doses, and would you be willing to give them to New South Wales?
The decision of National Cabinet is that other states won't be providing their share of Pfizer to New South Wales. I understand New South Wales is in need. I don't want to. I understand their problem. I'll put it this way. I understand their problem, but we're not prepared to give our Pfizer over. We need to get people vaccinated just like every other state does. The sooner we're all vaccinated, the quicker we can get out of this situation we're in. We are helping New South Wales with contact tracing. I understand we're helping with testing as well. So we're looking at whatever we can do, but we're not prepared to hand over our vaccines.
I imagine that's remotely for contact tracers?
Yes, that's correct. So we have contact tracers working on some of their cases. So there's a cooperative arrangement in place, and we're doing the same for Victoria. We're looking to do the same for South Australia, and we're looking to provide more support of that nature to New South Wales, but we're not going to hand over vaccines. The national agreement is each state needs to get its share of Pfizer and get its population vaccinated as soon as possible. We've done everything we can to keep the virus out, and we'll continue to do so, but one of the things we need to do to ensure we get out of this endless cycle is get our population vaccinated as soon as possible, and that's what we're trying to do.
Given the situation that we're seeing around the country, do you think it's almost a matter of time before the Delta strain infiltrates Western Australia?
Well, the Delta strain did come into Western Australia. So it came in 5 weeks ago. We crushed and killed it. We went through a lockdown. We got rid of it. But we're just doing everything we can to prevent it from coming back again. We have a ship in Fremantle Harbour with positive people on board. We have the eastern states with much infection. We still have people coming into hotel quarantine, so there's lots of threat vectors to the state. I did raise today the issue of Indonesia and ships coming via Indonesia at National Cabinet. The transport ministers are going to work on that, in particular in contact with the major shipping companies. I think part of the problem is crew members arrive in Indonesia on board ships. They get off, they go ashore, they might go to shops or bars or whatever it might be, and they pick up the virus. That is the problem. So the shipping companies need to put effort into keeping their crews on board when they're in Indonesian ports. And so that's the approach we're going to adopt with the Commonwealth and the transport ministers and the shipping companies to make sure we do everything we can to stop the transmission of the virus from Indonesia to ships that then subsequently come to Western Australia.
How many that might be able to happen?
Sorry?
How quickly do you think that might be able to happen?
Oh, well, the agreement is I'll work on it immediately. The Prime Minister was very good about it. He acknowledges it's a major problem. This is what happened when there was problems with Filipino crew members on board ships. The same approach was adopted. Obviously, we've turned lots of ships away. That's a big financial disincentive to the shipping companies to have it's a big financial incentive to the shipping companies to have people on board who are not COVID positive. So, this is something that will happen as soon as possible. So the transport ministers are working on it, working with the shipping companies. When the ships go into Indonesia, the crew don't go ashore, have minimal contact, that'll be good for everyone.
With the cases that you mentioned at the BBC California, how many crew members are now positive?
10.
So 10 in total?
10 in total are positive.
And was there any new the 10 that you mentioned today, is that old cases? Or?
Yeah, well, that's the cases we identified initially. So we took 3 crew members off. They're all in hotel quarantine. None of them have tested positive. There was one crew member who was negative on board. He has to stay on board in order to operate some of the equipment. So he's in a different deck, different cabin, different area to the other crew members.
Premier, you must admit, though, that the representation of killing off the virus is not accurate, given we've escaped it here, but in other parts of the country it's not being killed off at all.
Well, I think South Australia appears to be doing a pretty good job of getting it under control, and I think Victoria is as well. And what Victoria showed last year, despite a huge outbreak across Melbourne, is if you put in place the right measures, you can crush and kill it. I think that's the lesson of Melbourne. So I just say to New South Wales, and I've said this publicly, I've said it privately, they need to do everything they can. They don't leave any stone unturned. It's a risk to both New South Wales and to every other state and territory. It's terrible for people in Sydney, but prolonging the agony is in no one's interest. So, you know, I see all these images of people wandering around outside as though nothing's happening. No one's wearing a mask. All these people are at outdoor gyms, you know, lifting weight and mixing with lifting weights and mixing with one another. They have an approach where they have some local governments are locked down, across the road they're not, to the same degree. Those sorts of measures are half-baked. It's not a time for half measures. It's a time for dealing with it and taking the steps you need to take. And that's what New South Wales needs to do. Whether it's masks, whether it's locking down uniformly across the local government areas, whether it's getting the ADF out there to assist, soldiers, airmen, sailors, whatever it might be. All of these things need to be put in place. Some of their exercise rules, frankly, I think are inexplicable. When we had cases here, we put boundaries around the city and then we put roadblocks on those boundaries. So it couldn't go out to the country. They're now getting positive test results in Byron Bay and in Community Orange and Goulburn and other towns around New South Wales. You need to put measures in place to stop that. You can't just issue an order on Sydney and say, you know, you've got to stay here. That's good, but what we did was we put roadblocks out there. So if you wanted to go through them, you actually had to prove that you're from that community or you had an essential purpose, for instance, delivering goods, or you had to care for someone in that community. So, you know, it's not a time for half measures. If New South Wales wants to prevail, they've got to go full bore to deal with this.
Did you put forward some of these specific measures that you've just outlined to National Cabinet earlier today?
Yes, I did. So I outlined what we did. So when we had, as you recall, we had the big lockdown last year when it first hit. And I think we've had 3 separate incidents since then, and each time we've crushed and killed it, each and every time. And that's because we put all these measures in place that worked. You don't have one set of rules for one side of the street and another set of rules for the other side of the street. If you go outside, you wear a mask. If you mix with people, you wear a mask. You don't have sort of difficult to explain rules about these things. If you want to go to the country, you can't unless you have an extremely good reason and you have an exemption to go there. And we have police roadblocks to stop people going out there. All these things are hard and they're draconian and they're difficult, but that's what you have to do if you want to get it under control.
How was that received?
Well, with varying degrees of acceptance. All I'd say is, I think, look, New South Wales has progressively increased their measures. You know, today I think they added 2 local governments to the more heavily restricted area. But, you know, next week they might add another 2, and then the week after they add another 2. They need to deal with it properly now. Put all the measures in place now. It's a risk to everyone. New South Wales is not an island. Sydney's not an island. We're part of a country, and we've got to all be in this together and solve it together as quickly as we all can.
In the long run, very quickly, let's say if the vaccination in Western Australia does go above 80%, then I don't think we will need any lockdowns anymore, isn't it?
No, we haven't made that decision. So what we are doing is we've got a roadmap. We'll get further advice in coming weeks about what the levels of vaccination will be before we can go to next stages. So that will be based on the expert medical advice before we can make those decisions.
And after this frank exchange, it sounds like in National Cabinet, are you now more or less confident that New South Wales is going to drive this down to 0?
I'm more confident after today. Clearly the Commonwealth has a view that a lockdown is the most important measure we can put in place to defeat an outbreak. A lockdown is the most important measure. Vaccinations are are not a substitute for a lockdown. Vaccinations are how you prevent having a lockdown. They're not how you deal with an existing outbreak. So I think that's fundamental, and people need to understand that. And I think the Commonwealth gets that the lockdown is how you crush and kill an existing outbreak. Vaccination is how you prevent it in the future.
And just on the vaccines, obviously the New South Wales Premier caught everyone by surprise with her public appeal for other states to donate their Pfizer doses. You said that's not going to happen. Can you give your reasons why?
Look, the entire country's of that view. The Prime Minister was very clear that that wouldn't be happening. The best way out of this is that we all get vaccinated at a relatively quick rate, and across the country we get all our citizens vaccinated as soon as possible so we can go to next steps. Whilst we are doing everything we can to prevent the virus from coming into Western Australia, as we've learned, you never know when it's going to emerge. And so having our population vaccinated is one of the important things to keeping everyone safe within Western Australia, as indeed every state is doing. So, it's all right. Look, I understand their point of view. I don't want to be too hard on them about this. I could thump the table and say, we're not giving up our vaccines, etc. But I understand why they've asked for that. But I don't think that it's sensible to do that. We have a nationally agreed approach. We just need to roll it out as efficiently and quickly as we possibly can across all the states and territories.
The New Zealand travel bubble is closed to the country. Do you think WA is a bit stiff given that we're COVID-free here, that perhaps should travel
Look, I understand why they've done that. They're just being highly precautionary. They've always done that. It's worked well for them.
And just one on the Corrective Services Minister. Do you think he should resign after he accused the Broome Shire President of missing a meeting because he was too busy fishing when he was actually attending to some family duties?
I spoke to the Minister earlier today. He's very sorry, very contrite. He's passed on his apologies to the Shire President in Broome, and I think that's the end of the matter.
Just on Cyclone Seroja and insurance, we heard a story yesterday about a business and the insurer wouldn't provide a tarp to a damaged property, and that property was damaged further. Is that some of the feedback that you heard on your travels yesterday, and how disappointing is that?
Yeah, water damage is one of the things. So we've had one of the wettest sort of months that anyone can remember. And I might say for the wet belt, certainly in parts I was in yesterday, I was in Minganyu, Morawa and Northam, it looks magnificent because it's so wet. So everyone's looking forward to a great season. But obviously for properties that have suffered damage already, water damage is exacerbating the situation. So I went to a couple of properties. I met a lady actually in Morawa, and she'd had water damage in her home consequent to the cyclone. So this is obviously making the situation worse for people. So as I said, I've been in contact with the Insurance Council today. Just urge all the insurers out there, please get on with this. Please get out there and resolve these claims. Get contractors, builders and the like up there as soon as you can. These people are suffering. They need your help.
Is there any possibility that the conversations going on with the ship carriers and the transport ministers, would that prevent any kind of work coming here, any kind of ship docking here in WA?
Wouldn't have thought so. Actually, it's good for the ship owners, because when you think about it, if they have COVID-free crews, it's better for their business. If they have crews that are COVID infected, well then their ships will stop operating and they'll lose money. So the whole idea of making sure there's proper arrangements by the shipping companies when their ships are in Indonesia to stop the crews getting infected helps everyone, the crews, the companies, and especially Western Australia.
If they don't agree, is it going to cause a problem for them coming here?
Well, eventually that could be the case. As you know, we've turned away lots of ships. We've turned away, I can't remember, maybe half a dozen ships, iron ore carriers, various other products. We've turned them away, said you can't come in. In the case of the BBC California, the crew was so infected that we couldn't do that because the ship could basically then not function and could wash up on our coast with catastrophic consequences. So therefore, we had to take the ship in, and we'll get it ready as soon as we can. Hopefully it'll be about a 17-day program before we can get the ship to sail. We expect it might be around 17 days. to get the ship underway, the crew back on board and the ship away. And that's with, we're estimating about 17 days from when she arrives. So that's an estimate. So that's what we're working towards. But just back to Indonesia, obviously they're a great friend of Australia. They're our nearest neighbour, but they have big problems. And what we need to do is work with the companies to make sure that the crew on board the ships are kept on board and kept safe when they're in the Indonesian ports, rather than going ashore and getting infected.
The Prime Minister this week's repeatedly called for more AstraZeneca to be administered through the state-run clinics. Will WA consider making AZ available to the under 60s in those clinics?
No, we will follow the health advice. So whatever our health advice is, and it's by that body called ATAGI and also by the Chief Health Officers, we'll follow their advice in relation to the administration of vaccines. That's what we do. And look, I'd encourage anyone who wants to get vaccinated to go and get vaccinated in your category as soon as you can. But we'll just follow the health advice. We obviously have a lot of AZ. Obviously the whole country has a lot of AZ, but we'll just follow the advice that the doctors provide us in relation to who's eligible for what. Thank you very much.
Thank you very much.